I've been working in Zambia for 3 years. Maybe as you may know, maybe the civil registration rate, in the birth registration rate, is less than 10% 3 years ago. Then that is a very, very much problem because maybe mortality rate, mortality data is very, very important for prioritization. My position in the project, the chief advisor, then project scope is strengthening health planning. Then data management is very important for prioritization and the planning. That's why maybe I supported death information in Zambia. That's why I worked with the CRVS, Civil Registration and Battle Statistic Office, to improve the death information and the hospital's facilities. Based on analysis by our baseline survey, what we found is the most important thing is capacity of human being, human resources. How to code, ICT coding, also how to sensitize the people, also maybe a number of health resources itself is very, very lacking in Zambia. That's why maybe the low registration rate, death registration is taking place in Zambia. Also, distance between the home, also the hospital, also might be the very, very important. Go to the rural area between the facility to the home. It's 30 kilometers. So it takes more than 3 hours to reach at the health facility. So that's why maybe people doesn't want to go to the civil registration office to register the data. Zambia is focused on the health facility data. The main hospital in Zambia, the capital city in Lusaka, the hospital, there are 10,000 death cases per year. Then 30 to 40% of deaths account for the accounted death on arrival and the brought in death. Brought in death means the death cases already dies at admission. So 40% of deaths brought in death. It means that health staff cannot diagnose the cause of death at the time. We decided to focus on death arrival and the brought in death, how to identify the deaths. Then we try to introduce a verbal autopsy smart care system in Zambia 3 years ago. For me, really surprising because maybe in just 3 years, maybe they introduced smart VS system or the routine system in health information system. CRVS system, maybe what I didn't mention is the utilization of data. Actually, then once we get the data, how to use the data is the most important. The health system itself is very weak in Zambia. So after we got the data, next thing we need to think about the health system strengthening according to the data. That is the most important issue in Zambia. Expectation and improvement of the birth registration rate, also death registration rate. Also, we can capture the cause of death appropriately. Actually, now the cause of death on death certification, like natural death and sudden death, also fever, kind of thing, we cannot call the cause of death. So at the end, hopefully we can't code the cause of death based on death certification. So that is our expectation, but I'm not sure how long that it take. Maybe 2 years, maybe not so much. Maybe I think we need to think about the 10 years, more than 10 years. In Africa, Zambia. In my view, actually in order to evaluate sustainability, also we need to think about some economic evaluation of verbal autopsy, also civil registration improvement intervention. So kind of economic evaluation also very, very important for sustainability. Actually, then I'm working in Japan, and the Japanese and civil registration system so far not so problem, I think. Like the death registration rate is more than 99%. Also, if the death taking place out of the hospital, we're doing autopsy itself for all cases. So we have no problem maybe. But maybe as the Japanese government, we have some initiative to push forward the universal health coverage. So civil registration and battle statistics is one of the very important issues for universal health coverage.